Good afternoon. Welcome, everybody. Thank you so much for joining us for our November Win for Supportive Housing um, Learning Community. My name is Emily Band. I'm accompanied by my colleague, Dawn. And we are going to be meeting with you today to talk about how we can um, collaborate and coordinate care for the individuals we're working with. So the presentation title is Enhancing Collaboration and Coordination of Care in Supportive Housing. Just some basic housekeeping. I'm sure many of you are familiar with this if you've been here before. Um, we if your audio and your video are muted, you don't have the ability to show video and you don't have the ability to unmute yourself. You can also use your computer audio to listen or call in. To ask or respond to questions, you can use the chat. Please make sure if you are using the chat, you respond to everybody just to make sure that your comments are going to everybody in the meeting with us. Additionally, if there is something you'd like to say, I'm happy to unmute you. I can do that on my end, or you can just type in the chat. Additionally, if you need to have captions enabled, what you can do is click on the button that says captions, and then you should be able to see captions. I'm not seeing it on my bar, but you can enable captions if you need them. And then, as I said, this webinar is being recorded. The presentation and recording are going to be shared by Washington Healthcare Authority. Again, I'd just like to welcome you all. Today's webinar is hosted by DVHR through the Washington State Healthcare Authority. This is going to be an interactive training, and we do encourage you to ask questions and participate throughout the session. And as I said, the slides as well as the link to the recording of the webinar are going to be sent by email after the presentation. So today we are going to be again, focusing on this idea of collaborating to coordinate services and to ensure that services are being provided in an effective and efficient way for the individuals we're working with. So the purpose of what we're going to be talking about today and our learning objectives are to review the importance of collaboration and coordination of care and supportive housing programs, explore strategies to build and maintain relationships with community providers, and then also identify the role of the consumer in coordination of care of their services. I just want to ask, can everybody hear me okay? I know I saw a participant in the chat that said that my audio was a little bit choppy. So I just wanted to see if everything is okay. All right, sounds like people can hear me. So let's talk about the why. Okay, so why is coordination of care and coordination of services something that's important in supportive housing? So here on our screen, I have the core elements of supportive housing. This is something that you can find in SAMHSA's supportive housing toolkit. And the core elements of supportive housing really speak to the housing choice model of supportive housing and housing first. And they focus on the different important elements that supportive housing programs should have within their supportive housing program as they're building it. Okay. So there are 6 core elements: choice of housing, functional separation of housing and services, decent, safe, and affordable housing, housing integration, rights of tenancy and access to housing, and then flexible, voluntary, and recovery-focused services. If we delve a little bit further into this idea of flexible, voluntary, and recovery-focused services, right, we're really focusing on the idea that people should be consulted on what types of services and supports they need or want to receive, right? There should be this idea of self-determination, right? People have the right to choose what types of services they want to be involved and engaged in. And there should also be a shared decision-making process, right? when services are being decided for the person should be 100% involved in that decision-making process. So there's this sense of collaborating with the person to determine what services they will receive. Services might also consist of using evidence-based practices and also focus on recovery-oriented services based on functioning and improving someone's quality of life. Um, the thing I want to highlight about this, though, is the second bullet point, which says services may be provided directly or through referrals to other service providers. So when we're thinking about supportive housing and it being a community-based mental health service, we're also thinking about this idea of, or the hope that as a supportive housing provider, you will have the opportunity to be able to engage with other providers and leverage their services and attain their services and link the individual you're working with to those services. Because there will probably be a time where you are unable to provide a certain service for whatever reason. Maybe it's not something that your agency focuses on. Maybe it's not something that you're contracted to do per your state contract. Maybe there's not funding for that, right? So that's why there are other services in the community that you can engage with in order to ensure that, again, the person is getting the services that they want and that they need. When we're thinking about this idea of coordination of services, what we're really talking about is linking, monitoring, and evaluating. So coordination of services can really be looked at or thought of as like a three-step process, right? So we're thinking about that initial linkage where we're making this connection with the person to this service. Then there's going to be this aspect of monitoring. Monitoring can actually, you could look at monitoring in two ways, right? So monitoring can be on the side of the individual that you're working with. So when you're monitoring services, you're ensuring service delivery through having conversations with the person that you're working with and asking them about their perceptions of the services, whether or not they're finding them beneficial, whether or not they're meeting all their needs. The other aspect of monitoring that you can do is talk with the other service provider. And that can be collaboratively with the person and engaging in treatment team meetings. Or it can also be through like a phone call or an email with the other service provider, as long as you have permission to do so from the person that you're working with, from your client or consumer. And then finally, there's this evaluation, right? So as you're monitoring the services, you're essentially gathering data, and the person that you're working with, the service recipient, is also gathering data on whether or not these services are something that are helpful to them or something that's not helpful to them, right? So in the evaluation piece, you're making an assessment of the consumer's response to the services and following up accordingly. And that can potentially look like maybe working with the consumer to find a different service that does the same thing, but maybe something that's going to be more in alignment with what their needs are, or ensuring that the linkage is something that's maintained and that the individual is able to continue receiving those services. But you want there to be this evaluation process so that you and the person are making a determination on whether or not this is a service they still want to receive and whether or not it is meeting their needs. So before I move on, I want to just pause here for a second and see if anybody has any questions, any comments, any thoughts about the past couple of slides that I've discussed.
There's nothing in the chat at the moment.
Thank you, John. All right, we're going to keep going then. Oh, Marissa, would you like me to unmute you? You can take that as a yes. You should be able to unmute yourself now, Marissa. Oh, okay. No problem. So Sonia had a question. Um, how can we potentially give feedback to referral agencies around trauma-informed care and services for clients needing that extra careful help? When you say feedback, Sonia, I guess, can you clarify what you mean by feedback? Are you talking negative feedback, corrective feedback? Are you talking about positive feedback, like a suggestion? You should be able to unmute yourself.
Hello, everybody. I'm eating my lunch, so sorry, my mouth was full. This
No,
is
no
Sonia
problem.
from Port Townsend, Washington. I mean the sense that there's a potentially a really awesome, important referral I'm making for a person to get services that I can't provide. And there's a barrier to my client receiving that help because there's a little thing called trauma-informed care that some people are ready to provide, others aren't. I just continue to realize that it's one thing to read about it, it's another to practice it. So I'm talking about helping fellow agencies, you know, almost continuing education type feedback. And this might be a whole nother webinar, but sometimes there are barriers and you try one referral and then that's the end. The client doesn't want to keep trying in that lane of help. That makes sense.
So I just want to make sure I'm understanding. So it sounds like you've had an experience where you've maybe referred someone to an organization, but they're not providing trauma-informed services and trauma-informed care, and that's creating a barrier for the client to continue receiving those services. So you're asking about
Yes.
how to express that to the referral agency.
Yeah, in the evaluating section of this screen we're looking at,
Mhm.
assessing the consumer response means that the consumer is not willing to continue that relationship
Yeah,
in the current state, which does not include trauma-informed care.
right. Um, have you ever had the opportunity, like when a referral has ended, have you like received any feedback from the other provider about why? Um, or has that not necessarily been a conversation?
Not necessarily been a conversation. So I guess, yeah, diplomatically, carefully providing that feedback potentially. Because
Yeah,
I'm in a small town where there aren't a lot of options always
yeah,
for referrals and you can't go to another agency necessarily.
right.
Thank
So,
you.
yeah, no, no problem. And I think you bring up an important point, right? And I think this kind of speaks to something we're going to talk about in a little bit in terms of maybe some barriers to coordinating care, right? Because it's very hard to it can sometimes be easy to build relationships with other community providers because you all are in it for the same purpose, right? But a barrier to continuing to make referrals to certain organizations could be because the organization doesn't have maybe similar values as your organization, or there's like this misalignment with the types of services they're providing. So if you don't mind, Sonia, I'd like to leave this for like maybe 3 minutes from now, if that's okay. And if anybody has any thoughts about this, we're going to have a discussion related to this. So make sure you have that ready. But I just want to get through this next slide really, really quick. So, in thinking about the types of community-based services, just as a general overview, we're talking about mental health services, we're talking about rehabilitation-based services, and this could be physical rehabilitation, it could be rehabilitation recovery related to use of substances, it could also be rehabilitation and recovery related to one's mental health condition. We're also talking about crisis response. So the different crisis providers in your community in New Jersey, we have psychiatric mobile screeners that provide crisis intervention services to folks. So I'm assuming you might have something similar in Washington State. So anybody in your town, region, county that's providing that crisis response service. Um, different housing providers and services. Again, physical health and dental services, protection and advocacy. I know in New Jersey, we have Disability Rights New Jersey. I think you all have Disability Rights Washington. That is also an advocacy organization. Then there's also peer support, which could be different mutual support groups in the community like AA, NA, Smart Recovery. It could also be mutual support groups um, uh, like a group focused on individuals who are maybe experiencing grief or have a diagnosis of depression. It's kind of like a self-help group, quote unquote, self-help group for that. Or it's also family and community. So family and community-based organizations, but also just the person, right? The person that you're working with, their family members. And then obviously income and entitlements, right? So these are the menu of community-based services that someone could engage in. And when we're thinking about this idea of coordination of care and coordination of services, we're really thinking about how we can link the individuals we're working with to these types of services and then go on to monitor and evaluate those services. So now we're getting to this discussion that I wanted to have with all of you. So I do want to start with what Sonia said in terms of how to provide that feedback to other agencies. So feel free, other folks, to chime in. But something that I was thinking of is if there is like an anonymous way to provide feedback to the agency or organization. It could also be the person that you're providing services to engage in some self-advocacy for themselves. So maybe it's not even you as a service provider giving that feedback. Maybe it's actually the service recipient. We're going to talk a little bit about self-advocacy in a couple of slides, but that's also something that I was thinking. And then, does anybody else have any other feedback or any other suggestions for Sonia? Has anybody experienced that as well, where maybe services didn't work out and there was this challenge about how to communicate that to the referral? So Annette, you said with healthcare, justice system, um, how have other people navigated these types of situations? Mm. So unfortunately, it sounds like you did not have a good outcome there, Annette. So Cecilia, you said you've relied on other agencies and community to build a strong team. So it sounds like maybe you're in an area where there are opportunities to maybe rely on other resources. And it sounds like you've done a lot of networking to build almost a community of agencies to be able to do referrals with, which I think is an awesome suggestion. Angela, you said you're peer support, so I help people find all these things and then give them a voice. Also, so it sounds like maybe you're doing some advocacy, Angela. Yeah, absolutely, Cecilia, right? There could be some advocacy around contacting the city, contacting the state. Kaiza, getting training from other community partners on referrals is super helpful. So when you say that, are you referring to maybe like reaching out and talking to somebody about like what types of services they provide? Yeah. Melanie said continuous open communication to providers and other workers working with the client, including follow-ups. Yeah, so again, keeping an open door and an open line of communication. Um, so in general, what have people's experiences been with coordination of services? Um, would you say they've been positive? Would you say they've been, um, there's been some challenges, which I can definitely understand that being the case. And then Sonia, you said relationship building between care providers can help community strengthen the supports for clients, continuous modeling how to approach a topic, for example, around transgender client and their pronouns. Absolutely, right? And that's where all of you as mental health workers come in as advocates, right? And really setting that quote unquote example and modeling how to modeling to help the community and to help other providers know the right language to use. Um, Thank you, Patrick, for letting us know. I appreciate it. So Mark, you said coordination is not consistent mostly due to funding. So I'm assuming you're referring to maybe agencies losing funding and then unfortunately not existing anymore. Tiza, you said, for example, we are partnered with Coordinated Entry. They have monthly training on nominating clients, and I find that helpful because sometimes we forget things, but it also keeps us updated. Oh, okay, so that's awesome. Being able to have the organization that you're working with provide education on, I guess, how to work with them and how to use their services. That's kind of what it sounds like. Mark, okay, I'm getting it. Thank you. Mark, you said funding has been an issue. So other than funding, what are some other barriers to being able to coordinate with other community providers? I could imagine turnover, right? So it sounds like once you make a connection, it you're once you have that initial connection, then it can be hard to keep that connection because somebody has now left the organization. Um, Lack of communication. So maybe you're reaching out and maybe there's not a lot of responses. Yeah, and just knowing whether or not they even exist anymore or how to access them, not getting a response from providers, um, large caseloads. So yeah, that can be difficult, right? It can be hard to form relationships and really because something that when I was reading about coordination of care in the community, a lot that was coming up was networking, right? And the same way, I guess, if we were in the business world, we might be networking to form different kind of community partnerships. But I'm sure a lot of you don't have the time to go out and network with other providers because you're trying to provide services, right? Yeah, and it's difficult, especially then when it sounds like some of you haven't been able to engage in some relationships, but there's communication issues, there's maybe turnover. Um, it can be hard to find somebody at an organization that like stays and is consistent. Um, do you all find it challenging to connect with other providers because you all are providing similar services? Does that like feel uncomfortable or does that feel like something that's a barrier? Yeah, so there's also this competition of funds, right? So, you as an agency and organization are attempting to go out for certain funding. Um, and I'm assuming are applying for grants and things like that. that can be difficult then when maybe you have to now work with some of these other providers. That can kind of get a little awkward, maybe. I don't know if that's what you mean, Mark. I might be thinking a little bit too much into that, but I can understand that being it. Yeah, okay. I gotcha. Um, Alexandra, you said busy schedules and outreach, so we miss each other when trying to connect. So it sounds like you're playing a lot of phone tag. A lot of, and if you're only using an office phone, that could be very difficult. At the same time, when you're with a consumer and you're trying to meet with them and provide services, it's kind of difficult to be able to say, pause, hold on, I have to take this phone call, right? That's not something you can necessarily do. So that can be hard. And then by the time you get back to the office, have lunch, do your documentation, it can be hard to get back to that phone call, right? Um, yeah. Oh, I'm getting so much good stuff here. Sometimes dealing with other organizations can become difficult, especially when you have different approaches. Yeah, Brianna, and I think that definitely speaks to Sonia's um, comment earlier and concern earlier, right? When your organization or when the individuals that you're working with have a pretty realistic expectation that they're going to be provided trauma informed services, which again, very reasonable on their part, and that's not something that they're being provided, um, that can kind of create a challenge with trying to refer people to services. And I think again, an agency's values, or their like mission as an organization, that can also maybe be competing with some of the individuals that you're working with and the types of services that they need. Absolutely, you definitely need to have that communicate that ability to communication. So you want to make sure that there is that release of information. I will say though, around releases of information, obviously, if you're speaking about a specific person, you need that. But if you are interested in just learning about an organization services and just kind of gathering general information, you don't necessarily need an ROI for that. A ton of burnout for folks in this business that forget to check in with their wellness. This in turn tends to come out on clients as well as care coordination. Absolutely. People have been doing their job maybe for too long and aren't taking that time for self-care. And then that can impact service delivery, right? It's very common when practitioners are experiencing burnout for that to have a negative impact on their work. Uh, yeah. So Nat, you bring up a really good point. Um, it took you and I think your husband's on also joining a nonprofit group to even find about a lot of things, and it really is all about that networking. It's hard for families, especially because so many programs pop up and just disappear due to funding. Yeah, so it's really about that networking and being able to build those relationships, but it can be really challenging to do that when organizations are here one day and they're gone the next. And then is it Tiza or Taza? Let me know if I'm saying that. I apologize if I'm saying that incorrectly. But yes, burnout is a huge factor. I will say we're going to be doing our December webinar on self-care. So we'll probably talk a little bit about burnout. But burnout can have a lot of negative consequences. So just for all of us here, it's very important to take care of ourselves. And then Barbara, the individuals it's like Asia with a T. Oh, okay. I like that, Asia. Okay. The individuals we work with have limited income for housing, and the reality is that securing stable housing has become increasingly complex. Yes, Barbara. We could probably do a whole webinar on. I think we have done whole webinars on just the challenges of housing. I know housing and finding housing is incredibly challenging here in New Jersey. I know you all out in Washington are experiencing similar challenges. Housing is a huge problem. And it can be hard, right? Because when we're thinking about some of these referrals, right, you might refer an individual that you're working with, or you might have an individual that you're working with be working with a specific organization. And then due to housing, they might have to change. And now you need to make more referrals, or you have somebody living someplace, and now that organization that they're working with has closed. And now you have to find a new referral for them. And it might not be as close to where they're located, right? We're talking a lot about community and kind of building a community and a network of providers, but it can be really hard to do that if the community is very spread out. So we're talking about a lot of good information here, just to kind of better understand what we're all working with and the different challenges that impact the ability for all of you to be able to coordinate. But I also wanted to just ask you all, what have been some benefits of coordinating with other community providers? Because it sounds like there have been some good experiences for folks out there. So what have been some of those benefits? Yeah, absolutely, Marissa. Right. Very simple. The client has more support. They have more support. They have access to the services that they need. What other types of benefits have there been for folks? Absolutely, Mark. Right. So once that referral has been made, you've been able to, um, help the person to find a resolution to an issue or concern through that referral, right? That referral brought them that resolution. And then that sounds like maybe alluding to that knowledge, um, and getting more information from others as you've been able to coordinate services, getting to know the organizations, getting to know what kind of services they provide, maybe getting some training on what those services are. That's a good point, Dusty, right? So potentially getting more resources for the person, and then also faster, better outcomes. I mean, typically, if you have an organization that you do develop a relationship with, then you can sustain that relationship as long as that organization stays afloat. You can sustain that relationship and then make additional referrals. Uh, Wow, Mark. So you've partnered with many agencies to provide rental assistance up to $8,000 to $10,000. Alone, we can't even come close to those amounts. Yeah. So that is an amazing amount of money. And I can imagine needing to, I mean, thinking back to my work in the community, right? The individual that I was working with, the state in New Jersey, there will sometimes be funds for individuals to buy like startup funds for their apartment for things like clothes or pots, pans, utensils, sheets, towels, those types of things. So there's a certain amount of money sometimes allocated for that. But that's not even counting then the security deposit, and which could often be, a couple of $1,000s, plus, needing to get like an ID and other documents and internet and utilities, right? A lot of money goes into housing somebody, right? So I can imagine that working with other organizations that might have that financial backing is something that's very helpful for folks. Um, and yeah, Kenya, I think you summarized it really well, right? Being able to collaborate with other agencies to provide wraparound services is essential for client success. And this then provides more stability for clients as they have services and people to assist them when they might have fallbacks, right? having a community in a sense, right? Having a professional community, having a personal community, having people to be able to go to, maybe when a crisis is occurring, or maybe a relapse is occurring, or maybe they just need additional support. Um, and then again, helping clients with specific specialized services. So being able to refer them to supports like specifically for domestic violence or foster care supports. Thank you, Sonia, for bringing that into the conversation. I'm sorry, I'm still muted. Does what exist anymore in that? I'm not sure what you're referring to. And Mark, you said, I think it shows clients who might have a negative opinion of social services that multiple organizations, agencies care and will do their best to help. Yeah, that can be a really that can be really profound for people. Oh, okay, I got you, Annette. I understand. But having having the ability to see that so many people are willing to support you and provide that support, that can be really profound for people. So I really appreciate that point, Mark. So we talked a lot about coordination of services. And Barbara is just echoing collaboration with other agencies when it comes to helping with the domestic violence case is very important. Right? Everybody has to be on the same page. Yeah. So it's cool. Oh, I'm getting more. I'm going to keep going. It's cool connecting with other agencies and having a good rapport allows them to share more resources with us to help our clients. And I think in a perfect world, right? I think if we were in a perfect world, that's what coordination of care would really look like and allow, right? That networking would then really create a system of resources for people to be able to refer to, and there'd be that reciprocation, right? You're referring to them, they're referring to you, and that's really creating a large amount of services for the folks that you're working with, for your clients and consumers. And being able to, again, network and build those relationships is going to allow that sustainment. So there definitely are benefits to coordination of care. It's just about finding ways to overcome some of these barriers. So something that I would do when I was working in the community, and I will preface this by saying the community that I was working in New Jersey is probably very different than where you're working in Washington. I want to acknowledge that because I know a lot of you are in rural places. I was working in like a small city where there's a bus network and people are able to walk around in the community and there's tons of resources, right? So I just want to acknowledge that. But something that I would actually do as like the team leader, so I was the manager. I would actually sort of keep a running document of referrals, places that we would refer to, places that we received referrals from. I would keep multiple contacts, and I was the person who kind of kept and maintained those types of relationships, just to ensure that so that it wasn't something that my staff had to do and kind of keep up with. And if there were any changes, they would kind of let me know. But I was sort of the supervisor of that list, and I would keep it up and keep it up to date so that we did have all that information in one place. I'm not sure if anybody else does anything similar to that at your organizations, but that might be something to help with just keeping up with the contact information. Something else, and I don't know if you're without something that we'll sometimes see in New Jersey is we'll have different like towns, counties, communities will almost have like job fairs or like community events. And a lot of New Jersey providers will also make themselves present there. And that can also be a good networking opportunity. I'm not sure if those things are happening in your areas. And if they're not, maybe that's something to think about. If your organization has the time or the funds to be able to get something like going, that could also be a good way to be able to network. So Mark, you said you were just at the Thurston WorkSource job fair earlier today. Yeah, that could be a good way to network and just kind of get to know other resources in the community, what other type of mental health or substance use or recovery or rehabilitation oriented resources are in the community, and making that face-to-face connection, especially if it is something that's in person. So that's also something to do. I know for me, again, if I was a supervisor, I don't know how many supervisors are on the call today, but that's definitely something that I would try to do as a supervisor, just to be able to, again, meet face-to-face with other organizations and groups. So those are two suggestions and recommendations I have after kind of hearing some of the barriers that you all have experienced. Does anybody have any other suggestions or recommendations to make to the group about how to overcome some of these barriers? Cecilia said there's a provider appreciation gathering at Pier Olympia in Olympia, Washington. It's a way to network and meet providers, but also have some downtime and relax, eat some food, and just get to know each other in a personal level to collaborate. That sounds wonderful. Anything that has the word appreciation in it as a provider must be something you're like, oh, say it again. I love to hear that word, right? Because you all deserve to be appreciated. So I love that. And it sounds like it's twofold, right? And I know Washington State also has different conferences, right? I know DBHR, the Washington Healthcare, I know you all have different conferences as well. And if possible, I definitely recommend being able to trying to attend some of those conferences, again, to be able to just network and see other providers. And then there's presentations, so there's also great information. Awesome. So I hope that this aspect, thank you, Cecilia, for putting that information in the chat box. And it looks like it's under upcoming events. But I hope that you all found this aspect of the discussion to be helpful. I'm hopeful that it was, to be able to kind of talk a little bit about what some of these barriers are and maybe do some in the moment problem solving to see what can be helpful. Kenya, you also said, I also think many organizations are very separated. This is separated from within, which causes a lot of misunderstanding and lack of communication within the organization. This is very common in Clark County, making it difficult to refer places as people within the organization will say different things. So that's also very much a barrier when it sounds like the organization maybe is unsure of what types of services they provide, or maybe what admission criteria is, or whether or not they have different services or they don't have services. So that can also be challenging. So I want to transition a little bit to how we can support the individuals that we're working with to engage in their own advocacy, right? And this is kind of echoing what Sonia was talking about earlier in terms of somebody is receiving services and maybe they don't like those services or they're not helpful. And this very much speaks to that evaluation aspect of coordination of care, right? Being able to evaluate these services and then determining what we're going to do next. So when we think of social justice advocacy, I'm going to start really broad and then we're going to come back into the consumer, but I think it would be helpful to just think about and talk about what social justice advocacy actually looks like. So when we're thinking about social justice advocacy from a macro level, we're really thinking about public policy. Okay, we're thinking about the different laws, we're thinking about regulations, we're thinking about the people in power in our government. It's very much at this macro level, way above us, unless we have any senators or congresspeople on our call right now. Then we have the meso level, which is really focused on education, training, and community outreach. Okay, this is where a lot of service providers can come in. And then we have the micro level, and this is where mental health consumers come in, right? This is where that self-advocacy comes into play. So when we're thinking more about the macro level advocacy and public policy, we're thinking about different economic factors, we're thinking about political factors, we're thinking about cultural factors, and then we're thinking about societal beliefs around mental health conditions. So when we're thinking about advocacy from a macro level, we're talking about money, we're talking about politics, we're talking about culture. And in the context of this conversation, right, we're talking about like the culture within Washington State. We're talking about culture at a national level from the United States of America. And then we're also talking about stigma and what society believes about individuals with mental health conditions. When we're looking at this from a meso level, we're talking about education, training, and community outreach, but we're talking about it in the context of the person that you're providing services to. So the consumer that you're working with is in relation to these things. So the healthcare system, the education system, and the community, right? So how are these factors impacting the individuals that we're working with? And then at the micro level, we have the person. And this is where self-advocacy comes in, right? This is where self-advocacy, advocacy from friends, advocacy from family, and advocacy from the community can come into play. And self-advocacy, right, is, I think, a very important tool, not only for the individuals that we're working with, but also for all of us, right? It's important for us as mental health workers to be able to advocate for ourselves, for our organizations, for the mental health community as a whole, for the recovery community. But it's also important for us to help individuals learn how to advocate for themselves and figure out what that looks like for the person. So when thinking about some of these self-advocacy, best practices, NAMI has a nice article on self-advocacy and how advocacy can look at all three of these levels, at the macro level, at the meso level, and at the micro level. Okay. So when we're thinking about at the micro level, some of the best practices that we can support individuals in participating in are learning skills, education to inform treatment, and self-care. So before I move forward and talk about some of these things, I want to ask, how are you and your organizations teaching advocacy? Is there an emphasis on teaching advocacy in to the individuals that you're working with, to the individuals that you're providing services to? Is that something that you all are focusing on? Oh, sure, Sonia. So is there a focus at the organizations you're working with to teach self-advocacy skills to the service recipients that you have at your organization? So, Mark, you said, yes, any applicant for rental assistant must take a 30-minute financial difficulties online course as part of their app prior to review. You should put that in the chat, Mark, if you have it handy dandy. That sounds like a really interesting course that could be beneficial to folks. Um, but that I'm assuming has information on education on or if you could, could you speak to that a little bit more, Mark, if you can, in the chat, or unmute, or I can unmute you about what that course actually entails. And Angela, you said, I take my peers everywhere, and it is hard to get them to self-advocate for themselves. And agencies see me coming with people, and they know why I am there. They work with me too and make sure they speak for themselves. Oh, so that's awesome, Angela. So sometimes it's difficult for individuals to self-advocate. But it sounds like they are encouraging folks to speak to themselves, and they aren't looking to you to kind of speak for the person. Um, and yeah, not, it can be challenging it can be very vulnerable, right? To speak up for yourself, and to feel confident enough to do so. But it's really empowering when you do speak up for yourself. Uh, So Mark, you said 100% it's designed to educate on good basic spending habits and how credit works. There's 20 courses in total through Twin Star Credit Union, money.edu. Thank you, Mark, for putting that in the chat. I hope that this might be a good resource for all of you folks out there. So maybe I might have to look into that. But it sounds like it has good information. Kenya, you said, I work specifically in housing, and before finding housing and move in, we work on a budget together to help them understand their finances. So Kenya, it sounds like focusing on that education and that skill building, right? Educating folks on budgeting and helping them to just understand their finances better and learn that skill. Sonia, you said, yes, we have sustainable independence as part of our organization mission statement. The goal is to have learning happen while they're in our transitional housing program up to 2 years. It's hard to understand how each client might need different supports for their specific needs, not a one size fits all approach. Absolutely. You might have somebody who is maybe really good at certain skills based in advocacy or rooted in advocacy, but maybe they're not informed on, their treatment. Maybe they're experiencing a side effect with a medication, but they're not in a place where they feel comfortable enough to speak to their provider about it, right? Or maybe it's the opposite. Maybe you have someone who is very happy to talk to their providers, but is uncertain about learning skills to be able to communicate certain needs, right? So it very much isn't a one size fits all approach and can be very specific to the folks that you're working with. Any other thoughts on self-advocacy and how you all are learning, teaching individuals who you're working with about self-advocacy or encouraging self-advocacy? Patrick, you said someone with a mental health condition like PTSD, right? Everything can be and feel like a trauma trigger, right? The person might go into freeze. It can be very challenging when you're experiencing that kind of symptom, or that when you have that experience. Oh, I lost my video for a second. I'm like, where did it go? Sonia said many service programs are open business hours. Many of my clients work during those times. How to help them advocate for them to have non-business hour availability for their needs.
Emily, could I jump in for one moment?
Yeah, absolutely, Dawn.
Yeah. So I was thinking about what Patrick said, and individuals with PTSD who may have triggers. And so, responses may be different for different people. Some may freeze and not be able to, think about advocating for themselves. And I think that this may get back to an individual's question. I'm sorry, I can't remember who posed it, but regarding trauma-informed services, I think it's really important to find out if there are ways that um, or I should say, what is the person's level of readiness in being able to self advocate? And that we also understand that for some folks, it may take time to build up to that, right? And so there may be a little bit more of advocating or making linkages by the service provider, by all of you who may be serving as a case manager or care coordinator, and as the person learns the coping skills to deal with or how to handle triggers when they do experience them, being able to then take on some of that self advocacy, which could be really empowering for a person with a trauma disorder, right? To be able to kind of like affect their services and the linkages that they have and build up those resources around them. But I think that it's really important to kind of assess where the person is for each of those advocating for each of those services that you're looking to link them to, right? Because it might be different when we're talking about an individual going to a physician where they may have a very specific set of responses, right? To maybe medical care or somebody getting close to them or something like that, versus maybe advocating for other services like nutrition assistance, food stamps, those sorts of things. So might have to look at it on a case by case basis.
Thank you, Dawn, and I appreciate you bringing that back into bringing the assessment of readiness piece up, because I think that's where you definitely want to start. And I'm sorry that I didn't mention that in this. But yeah, you as a practitioner, as a provider, you do want to have a starting point, right? For where the person is at and what their readiness is around self advocacy. And again, to Dawn's point, their readiness might be in one place for learning skills, but their readiness might be in a different place for participating in different treatment planning options or getting that education on treatment planning. So it's very important to be able to acknowledge that and be mindful of that as we're kind of going into these different best practices. And Annette, you wanted to, I'm gonna allow you to talk. So you should be able to unmute yourself now, Annette.
Can you hear me?
Yes.
Okay. Um, a perfect way of describing getting someone to self-advocate. Like I've tried to self-advocate for myself. And you're right, it's totally empowering. But perfect example, let's say three different mental illnesses. One person just wants it to disappear and want to act like nothing happened, so they just keep themselves busy, right? And then they forget to take care of themselves, and it just all hits them all at once. And then there's people like me who I don't show it, no one can see it, so they never think I need it, even when I ask for it. And then so I self advocate, I say what happened to me. No one likes the word rape, no one likes the word because it triggers everybody, like everyone just like runs away. And it's a lot harder to get help when you are self-advocating for yourself, when you're being raw, honest, explaining things. This person's going through this person's going through that, and people can't cope. At least in my county, it seems like they throw them to the side. Is that a way of putting it?
Yeah. So it sounds like you're really feeling unheard.
Oh
And
yeah.
you're,
Oh, totally.
yeah. And that must be incredibly frustrating, right? It sounds like you're trying to do what you can to advocate for yourself. But the system's almost going against you.
That actually, you just said that perfectly. Yeah, every single time, actually. I keep all copies of everything for a reason, and I'll literally say what I need, what would help me, and for some reason, because I can say it, I guess I don't need it because, like, I don't have a record or anything like that, but I went through a rape case. I lost my job. I have a cyst in my brain, so like, so my memory's going, but because I keep standing up, because I refuse to fall, because I want my children to understand that, perfect doesn't exist, but giving up is. So with other people, I see other people who need to self-advocate, but they can't. So it's a lot easier when you see one person doing it, so it helps them have a voice, and then they start doing it. But then, right when you do talk, like, they just shush you away. They try to. I don't know how to explain that part. See, that's where it goes. I have literally have said straight up everything that what my family would need and all that kind of stuff, and barriers, communication, not connecting. I got really lucky for going into Pittsburgh because I get to do trainings like this and talk to you guys like this. But like, we have the greatest lived experiences. We have a felon daddy, for being wrongfully accused. We got an IEP kid who's highly intelligent. We have rape victim, a cyst in the brain, and PTSD, and homeless. So we hit like every mark. If that makes sense.
Wow. And I just want to acknowledge in that your peers here are commending you just for the work that you're doing for yourself and for your family. But I appreciate you I appreciate you being vulnerable and sharing your experience with all of us, because I think it can, as when you're coming from the perspective of just service provider, it can be, we want to empathize, right? But we don't really know what you as a service recipient are experiencing. So I really appreciate you speaking out in in this setting and letting us hear your experience and what your family has been through and all the work you've done to try to advocate for yourself.
Well, it helped me advocate for others, so I can advocate for myself. It's one of those, like, I help
Yeah.
others, but really it's really for myself to make me feel better. But
Yeah.
but I'm not trying to talk about just me. I'm just trying to explain how even when you do try to self-advocate, it's really hard to keep standing when you keep getting shut down.
Right.
You're
So,
absolutely right, Annette, and I really thank you for sharing kind of your raw testimony, because I think probably a lot of people identify with that. And for those of us who haven't had that experience, I think it's really important for as providers, to take that in and to remember that despite how someone presents in front of us, right? Because I've had that experience working with individuals who felt as if they weren't taken seriously enough, the help that they or the resources that they needed to access. And I think that we really need to take that in and remember that every person is valid and the needs that you present are valid. And I really am glad that the individuals that you work with have you who fully understands those challenges. So I just wanted to acknowledge that as well. Thank you.
oh, thank you. Sorry, I didn't mean to try to put it all about me. I was just like, the only way I could talk about self-advocating was my story. So sorry. Thank you.
No, no need to apologize in that, because I think your firsthand story is helpful to understand that this is what a lot of people are experiencing, right? And I am going to talk a little bit about how we can support individuals to self advocate. But I think it is important to understand. And I think it's to Dawn's point, and kind of in this similar to what she was saying in terms of like readiness and being able to understand where the person is at, and how when you're going through this process of advocating for yourself and advocating for yourself and advocating for yourself, and you're still hitting barrier after barrier and you're not getting the support you need, that just feels awful. And I think it is important for us to understand that, right? As I am talking about the different things that we can do on our end as service providers to support people, it is very important to understand how, in the same way as service providers you're experiencing barriers with coordinating with other providers and thinking about how frustrating that is for you all, it's also very frustrating for our service recipients when they're experiencing these types of barriers with receiving services. So this is very much in line with the conversation we're talking about. So when
Thank
we're
you.
thinking, no, thank you. When we're thinking about skills, I just put a couple on here, but I also wanted to leave room for folks to chime in on what types of skills you think might be important to teach folks when it comes to self-advocacy. So I focused on communication and problem solving. That was what Nami kind of talked about, but I think there are many other skills that can come into play when we're talking about advocacy. So when we're thinking about assertiveness skills, right, we're thinking about setting boundaries with people. We're talking about using I statements. We're talking about saying no. We're talking about using and teaching active listening. So these are all different types of assertiveness skills, or skills that kind of fall under that umbrella of assertiveness skills that you can teach folks. The other piece of this is problem solving. So I'd like to highlight the scale method, which is something I've done a webinar on previously, but it's essentially specifying. So you're going to be specific about what it is you would like to achieve. So you're not focusing on the problem necessarily, you're focusing on the outcome and what that outcome is that you're looking for. Then you're going to consider all the solutions and how to get there. Then you're going to assess the best solution. You're going to lay out a plan, and then you're going to execute, and you're going to evaluate that plan. So this is a very structured approach to problem solving, but there are many, many methods to problem solving. And absolutely, Mark, right? So that organization aspect of it, right? Being able to organize and outline thoughts prior to a meeting where you are self-advocating, that is something that can be very helpful. I think to that, doing something like role playing, if the person is going to be participating in a conversation, it might be helpful to role play some of these skills, especially these communication skills, or you as a practitioner modeling some of these skills. Any other thoughts? And yes, absolutely, Patrick, right? Collaborative problem solving. And then coping skills, right? Kenya, regulation of emotions, keeping in mind and maybe practicing skills to help the person if they're becoming frustrated or if they're becoming overwhelmed, right? Being able to regulate their emotions. Our colleague Crystal just did a webinar on DBT 2 weeks ago and last week. So if you are interested in any skills related to regulating emotions, DBT skills are really great skills to incorporate into your practice and teach folks. And that might be something to look for on Washington's YouTube page. And then that reassurance, right? Just reassuring people and providing that positive feedback, right? When we are doing skills teaching, when we are teaching folks skills, we want to make sure that we're providing corrective feedback, but we also want to make sure that we're providing positive feedback and letting people know when they're doing a skill correctly and helping to kind of build that confidence.
I call it praise, polish, praise, Emily. So,
Yes.
yes. Praise the accomplishments, the attempts, the growth, help folks polish for either that experience, that encounter, or something similar, maybe adjacent to it, and praise again, right? Because we all need that when we're learning and developing skills.
Right. And yes, absolutely. And that's how I think of it, as the compliment sandwich. But I've also heard praise, polish, praise, which is another, I think, great thing to keep in mind, because we're all going to have times. I mean, I think of sometimes, sometimes I'm really great at communicating, and in some situations, I'm not as great at communicating, right? But the situations where we communicate well, those are the situations that deserve just as much notice and feedback as the situations where maybe we're not performing the skill as well. when we're thinking about education to inform treatment, I would check, Sonia, the Washington DBHR YouTube page. After our session today, at some point, you should receive a link to this video, this recording. Washington has their own YouTube page that has, I think, a lot of the recordings of the different webinars as well as learning communities that we facilitate. I would assume that it's on there, but I am assuming. The other thing I would recommend doing is if you find the YouTube page and you don't see it on there, I would maybe recommend reaching out to whomever your contact is at Washington State to see if they might be able to tell you where the recordings are. Tasia, reminding clients that we all have strengths and weaknesses, and that's okay. There's always room for improvement. Absolutely, absolutely. So when we're thinking about education to inform treatment, we're thinking about different resources that you can utilize and folks can utilize, right? So illness management and recovery is a great resource that really teaches, it's focused on illness management and recovery and teaching skills to help people continue to live in the community and manage their mental health condition. But it has a lot of great information on different mental health diagnoses. So it has a plethora of information, but what I really wanted to hone in on for the purpose of this are the different modules that focus on the different mental health conditions and the diagnoses and what they entail for folks. Because that could be information that could be helpful to the person, right? Also, different online resources. So when we're thinking about providing information to folks, if someone is having a concern about a medication, maybe you're using an online resource to provide education to them, or helping them to find that information. Maybe you're using a website like NAMI, like the National Alliance on Mental Illness website, which also has a lot of really great information on the different mental health diagnoses, research related to them, as well as research and information related to treatment for mental health diagnoses. In addition to kind of doing your own research or the person doing their own research, there can also be that communication with providers. So speaking to the pharmacist and asking the pharmacist about side effects and information related to a medication, having conversations with the provider and with your doctor or with your prescribing physician is also something that can be helpful. Other ways to inform your own treatment, and this is more active, and but I did want to include them, is developing an advance directive. So an advance directive is a really great way to help people feel empowered in their treatment and what their treatment is going to look like if they're ever in a crisis and are unable to make decisions for themselves. Because it provides that plan to whoever is the physician on what type of treatment that they want, okay? The other thing that you can do with folks is RAP planning, right? And really coming up with that relapse prevention plan, again, as a way to help empower the person and prepare, right? Coming up with that plan when the person is in crisis and they see that they wrote it and they see that it's coming from them, and it's almost like, you know, watching a video that you made for yourself 10 weeks ago where you're like, if you ever in this situation, you're hearing from yourself, right? And that's something that can be very helpful as opposed to you as a service provider telling them, hey, remember when we talked about this, or you should do X, Y, and Z. And then the last thing is self-care. And I think this speaks to that frustration that folks can experience when they are trying to advocate for themselves and maybe they're hitting dead ends. And I think this also speaks to the conversation we had a little bit earlier about burnout, right? You as a provider can experience burnout. We're seeing that a lot of other community providers are experiencing burnout. Self-care is important for everybody, but it's also important for the individuals that we're working with, right? So when we're thinking about different self-care strategies, some things that I came up with were connecting with friends and loved ones, right? Connecting with others is something that brings a lot of joy to folks, and just making those connections, catching up with people is something that can really make us feel refreshed and recharged. Participating in hobbies and activities, doing something that you enjoy, right? Doing something that is maybe going to support you in just doing a mindless activity where you're not thinking about the frustration is something that can be helpful. Engaging in exercise, right? We know that moving your body is something that helps you to feel good. It releases those feel good chemicals. So, whether that's taking a walk, whether that's doing a dance video, whether that's just walking around your house, maybe in your backyard, maybe in the community. I'm not talking about lifting weights or anything like that. I'm just talking about moving your body in whatever way makes you feel great. That is also something that can help, as well as eating nutritious foods. And feel free to put more self-care strategies in the chat. Sonia did. I'd love to hear more because I am all about sharing self-care strategies. But the last thing I wanted to mention was eating nutritious foods. And I was a little cautious about putting this on here because I know that sometimes the individuals we're working with don't have the finances to be able to access those quote unquote healthy foods. But that's why I wanted to say nutritious, because there are a lot of foods that our individuals might be able to access with the money that they have that still have those nutrients, right? Things like beans, rice, those are nutrient dense foods. Fruits, even canned fruit or the fruit in the little fruit packets, that still has the nutrients, right? Frozen fruits and vegetables still have the nutrients, right? Community gardens, right? They're, again, access is going to be a little bit challenging. So I'm trying to stay away from that word healthy. We're not talking organic. We're just talking about nutrient dense, things with antioxidants and good nutrients. I'm not a registered dietitian, so I can't give you a lot of information on nutrients, but fruits, vegetables, whole foods, that's where the nutrients are.
And can I add to that, Emily? I think it's
Absolutely, Dawn.
really important when we look at like some of the social determinants of health, that we realize that in a lot of areas there are these food deserts, right? Where it's hard to access what we think of as fresh, nutritious, healthy, quote unquote, foods. And so we do, I think, have to be what's the word? Creative in how we can help people identify what is nutritious from what they may be able to access or even receive if people are, reliant sometimes on food pantries and things like this. There are healthier choices that can be made and still keep people feeling well.
Absolutely, Dawn. Thank you. So as we're coming to a close, I do want to acknowledge some of what you guys are mentioning in the chat. So Sonia, you said coloring books and puzzles help you to unplug your brain from work. Cecilia, you practice holistic care as well for your own mental and physical concerns, and you try to guide the clients into trying new things that might help them, that perhaps might not be something they thought about, like acupressure, cupping, massage therapy, which could potentially even be covered under their health insurance. So I love that. Annette was answering Sonia's question. Cecilia, you said community gardens and then provided a resource. Thank you very much. Marissa, you said one of our staff does a cooking class using what was available at the food bank that week. That sounds so cool. I love that idea. And yeah, Annette, right? Just being in nature, right? Going into the woods, going into the forest. At first, Annette, when I read it, I saw nature and rocks, not nature rocks. I'm like, yes, rocks. Rocks are awesome. So if you're into rocks or stones, that's also something that's cool. So yeah, a lot of great resources. But again, self-care is important for everybody. Tasia, I totally agree. A lot of my clients are in recovery, so they resort to a lot of sugar, which is obviously not healthy. It is great to remind them to eat more nutritious foods and drink water, right? Just drinking water. As I sit here and drink my energy drink, it is also important for all of us to drink water, right? So we're gonna put the evaluation in the chat box again. It is so important to stay hydrated. But this is all I have in terms of content. So I did want to leave, we still have a couple minutes left, but I did want to leave some time if anybody had any other comments, if anybody had any other questions around the topic, any other suggestions or resources you wanted to share in the chat with each other. I know that this is a really great opportunity for you all to network with each other. So if you wanted to put any of your contact information into the chat, feel free to do so. If anybody is interested in sharing and you want to save the chat, all you have to do is click on the 3 dots next to where it says to, and it should say everyone. You just click on the 3 dots and you can actually save the chat. So if anybody is interested in putting their contact information in there as a way to network and kind of keep other people in mind, feel free to do so.
Annette, just seeing your comment about bringing back to woods, I was very much the same. I spent most of my time in the woods behind my house. But there are people who talk about in more holistic medicine, this idea of grounding, and being, literally connected to nature and the energy and the vibrations that nature provides, and feel a lot more relaxed. So I think that there's some science behind that too. Not just, our memory, but also some science to being grounded, whether it be in the forest or on the beach or wherever it may be. Um, I like that
Barefoot.
you brought that up.
I know that sometimes people will say like, go touch grass as like a reality checks kind of thing, but sometimes just walk. I know it's cold and it's cold here in New Jersey. I'm sure it's cold out there in Washington, but even just taking your shoes off and putting your feet on the ground in the grass is something that can feel really grounding. So again, if you would please feel free to do so and be kind to do so. Please just check out the evaluation, give us feedback. We appreciate your feedback. We love feedback. We really want to hear what you have to say so that it can inform the direction we go with these Win for Supportive Housing Learning Community in the future. But that's all I have for today. So thank you all again. We appreciate your time, attention, and participation. Again, today's webinar was hosted by DBHR through the Washington Healthcare Authority. I do want to remind everybody that the slides and the link to the recording, as well as a wealth of other resources, will be available in the follow-up email. Don't forget to check out the Foundational Community Supports newsletter for all things FCS. And that's all we have. I'm going to stop the recording for a second. Here we go.